Today's topic of discussion is hypothyroidism. Hypothyroidism. It is a clinical state which results from inadequate secretion of thyroid hormones T3 and T4. Now, its manifestation depends on age. First is cretinism, which appears in children few weeks after birth, and second is myxedema in adults 4 to 6 weeks after birth. Cretinism. Now, what is cretinism? So, cretinism is a state of hypothyroidism. Cretinism is seen in babies or children due to hypothyroidism. Actually, cretinism does not appear immediately after birth, but after 4 to 6 weeks of birth, after a few weeks of birth, it appears, and its appearance is like bloated body. Second is sluggish movement. Croaking voice while crying. Croaking voice while crying, like frogs cry. Next is flabby and big tongue. And the main theme of cretinism is stunted growth. So, stunted growth, which is the important clinical feature regarding cretinism. Big tongue produces difficulty in breathing and difficulty in swallowing. Round face of baby appears like this. Next is flat or broad nose. Round face, flabby or big tongue, croaking voice, sluggish movement, bloated body, stunted growth. And if it will be untreated, it produces permanent mental retardation. Permanent mental retardation is the worst consequence of prolonged cretinism. So, permanent mental retardation is one of the consequence of hypothyroidism. in children. So these are the clinical features. About investigations. Since this is a state of hypothyroidism, so T3, T4 level is decreased. T3, T4 level decrease, and TSH, which is thyroid stimulating hormone, it is increased. So this is very important information about investigation of hypothyroidism in children or cretinism. Now next is myxedema. Myxedema. Myxedema means as it includes edema. So the main feature is edema in myxedema, and myxedema is a state of hypothyroidism found in adults. So it is adult onset hypothyroidism. Adult onset hypothyroidism, and its etiology is basically lack of iodine in diet. Second is surgical procedure of thyroid gland previously due to any cause. Third may be thyroid cancer. So fourth, it may be genetic. So these are the some etiology which is found in myxedema. Next is clinical feature of myxedema. It is characterized by edematous face, and the type of edema is non-pitting type. Non-pitting edema. Puffiness under eyes. Puffiness under eyes. In adult, constipation is prominent symptom. Constipation. Mentally and physically lethargic. Patient is mentally and physically lethargic. So patient is lethargic in both level, mentally and physically. Next is patient wants to take sleep up to 14 to 16 hours. So sleeping time is more, and it may be up to 14 to 16 hours. Next one is gain in weight. Gain in weight. Gain in weight. This is also one of the prominent manifestation in hypothyroidism in adult. Next is polymenorrhea in females. Polymenorrhea in females. So these are the important list of clinical features regarding myxedema, which is under the state of hypothyroidism. So what is the etiology of cretinism? Main etiology of cretinism is Congenital absence of thyroid gland. Congenital absence of thyroid gland and lack of iodine. But lack of iodine is secondary cause, while congenital absence of thyroid gland is the primary cause in case of cretinism. And in case of myxedema, sometimes it may be autoimmune because some antibodies are formed against thyroid follicles, which is known as thyroiditis, autoimmune thyroiditis and Hashimoto's thyroiditis. So these are the etiology and clinical features of hypothyroidism.